Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month, I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness.
So, could you maybe share with us some of the examples of this cognitive behavioral therapy for insomnia? If you could talk us through a little bit of this.
Sure. Yeah. So CBTI is a short form behavioral and cognitive therapy where you would meet one-on-one or in a group format with a therapist, or you could walk through CBTI on your own through a CBTI app or through a workbook. There are many different options for how to get CBTI. So you can work your way through usually 4 to 8 sessions or 4 to 8 modules, or maybe up to 10 or 12 modules. And what you would do is identify the behaviors and the ways of thinking about sleep that are keeping you stuck. So whether it's sleeping in too much or trying to spend too much time in bed or thinking of your sleep as a really fragile thing that you need to manage and really tiptoe around. Right? So that I think many people feel that way, like, oh, I need to cancel my evening plans so I can go to bed at a decent hour, or I can't schedule that important meeting for tomorrow morning because I probably won't sleep well and that will ruin my concentration for tomorrow morning. When we act like that around sleep, when we try to manage it and strategize it and hack it and really work around it and plan around it as if it's very fragile and as if it's not resilient, then we're actually telling our brains that we cannot sleep well. And so we end up sort of shooting ourselves in the foot. And before it, there's a lot of performance anxiety around sleep. We're dreading bedtime. We're waking up in the middle of the night and we're thinking, oh, shoot, the rest of the night is ruined. I'm not going to be able to fall back asleep. And the frustration that comes with that, the anxiety that comes with that, is then the thing that keeps us awake. So CBTI is all about identifying these factors and working through them, finding new ways of thinking, new ways of acting around our sleep, and also hitting the big reset button for the physiology of our sleep to reset our sleepiness, to teach our brains that, yes, we actually can sleep, we are sleepy, and we're sleepy at the right time in the right place.
I love that. Sleep has been disrupted for so many people during this pandemic simply because our life routines have been thrown off. And we hear about the importance of maintaining a daily circadian rhythm. But what could you share with us about people who are night owls?
Yes. So first of all, I'm personally a night owl, so I love this question. I'm all about helping out fellow night owls through disruptions. So this is an important topic. So first of all, let me say that we all already inherently have circadian rhythms. So this is another thing that we can trust our bodies to do well, as long as we can support our bodies to do it the natural way. So here's what I mean. We all have approximately 24-hour rhythms in our biological function. And that's not just with sleep-wake, but with our hormone secretion levels, our body temperatures, even our gene expression goes by these approximately 24-hour rhythms. And it's really awesome when all of these rhythms are in sync and our sleep-wake rhythm sort of follows the general circadian rhythms, and our master clock in our brains knows how to run the show on time. So it's really great when every rhythm is in sync with every other rhythm. Now, it's hard sometimes for night owls because we have to live in worlds designed by and designed for morning birds. So we've all heard the age-old early to bed, early to rise makes a man healthy, wealthy, and wise. This is a quote by Ben Franklin, a notorious morning bird who, good for him, was very productive, very wise and wealthy, and that's great for him. But many of us are night owls and biologically hardwired as night owls, and that will not work for us. And being a night owl doesn't mean that you're lazy or you're a party animal or you can't be disciplined. It's not any of those things. We are just wired, as I said earlier, maybe evolutionarily to be awake late into the night to save the rest of the tribe from predators. So you're welcome. And we have this biologically hardwired tendency to be awake and alert and productive and creative in the evenings and to really not want to get up early in the mornings. And if we are allowed to live by the rhythm that we are wired by, we can do great. We are just as healthy, maybe not wealthy, but wise and creative as the early morning birds, but we really need to be allowed to live like that. But you mentioned the pandemic, and the pandemic could actually be a silver lining for some night owls because many of us are not having to commute into work in the morning anymore. So we are able to sleep in just that much more.
Mhm,
Because we're working remotely, many of our bosses are letting us be pretty flexible with our hours. So that means
mhm.
we can work more in the afternoons and evenings and sleep in the mornings. So, pros and cons with the pandemic. Certainly, our routines are disrupted. We are sort of losing track of our good sleep habits. But at least for night owls, we may have the opportunity to live by our rhythm more.
Right, right. And that's kind of exciting. That's kind of good news
Yeah, for
in the
sure.
midst of all of this, right?
Very, very few silver linings, but this might be one of them.
Yes. Yeah. Yeah. So I was listening to your podcast and I learned so much about sleep. And that's what leads me to this next question because you touched on this in one of your episodes. How does substance abuse actually contribute to nightmares? I found this fascinating because oftentimes we realize that substance abuse can disrupt sleep, but the thought that it could contribute to nightmares is, to me, amazing. And what other risk factors contribute to nightmares? And what can we do if they're frequently occurring? So I know that's kind of a bunch of questions in one, but
That's okay. Yeah, I love this question. I find nightmares fascinating. And this is an area actually in which I'm starting to do a little bit more research in my work. So,
Mhm,
nightmares are dreams, basically, but they come with not only frightening content, they also come with our bodies and our brains becoming very aroused in a bad
mhm,
way. And so dreams occur mostly during REM sleep, so rapid eye movement sleep. They occurred in other stages of sleep too, but mostly during REM. So REM, as I mentioned earlier, is affected by some medications, including some antidepressant medications. But turns out REM is also affected by other substances too, like alcohol and potentially other recreational drugs. I don't know as much about which substances do specifically what to REM, so I don't want to say the wrong thing here. But let me sort of generally indicate that substance abuse tends to sort of mess with your REM, whether
mhm,
by suppressing it or disrupting when it occurs during the night or how much it occurs during the night. And even if it's not directly messing up REM in those ways. Just by
mhm,
disrupting sleep, you may very well be disrupting REM sleep because
mhm,
if you're not getting enough sleep, for example, then your brain will have to make up for deep sleep first before it does REM because deep sleep is a little bit more important to recovering your body. So
mhm,
if you're frequently sleep disrupted or sleep deprived due to using a substance, then you may end up being deprived of REM sleep. And when you're deprived of REM sleep, then your brain has to make up for REM sleep, and that's called REM rebound. And when you have
mhm,
REM rebound, basically when you go back into a sleep opportunity, REM comes back sooner and faster and stronger. And you end up having more vivid dreams, maybe dreams that are more bizarre. And if you're dealing with a substance that may be disrupting your perceptual functioning,
mhm,
or
mhm.
your cognitive functioning in other ways that may show up in your dreams as well. So,
Ah,
substance use and abuse can certainly contribute to nightmares through either direct or these indirect paths. And some other ways that we may be more prone to nightmares is one, if we have experienced psychological trauma. So, people with post traumatic stress disorder are much more likely to have nightmares and frequent nightmares than people who have not experienced trauma. And even if someone
okay.
doesn't have full blown PTSD, but they have experienced some trauma in the past. Their sleep may very well be disrupted and their nightmares may very well be more frequent. And being a student makes one more prone to nightmares, but that may very well be a combination of being more sleep deprived or using more substances, pulling all-nighters, things like that. So I'm not sure if it's just the student status or the lifestyle things that come with being a student. And just a couple of other things that may make us a little bit more prone to nightmares is being physically ill or having a psychiatric diagnosis. And this may be temporary while we are ill, like if we have a fever, for example,
Mhm,
we may
mhm.
be more prone to nightmares then. But often we recover from nightmares after the illness is over. Now, if we become frequently prone to nightmares, if we end up having what's called chronic nightmares or nightmare disorder, then that's something similar to insomnia where maybe the initial thing, the initial trigger for the nightmares is gone. Like we're no longer using the substance, or we no longer have the anxiety disorder, or we no longer have the fever, but it seems like nightmares are continuing on their own pretty frequently, then it may just be that nightmares have taken on a life of their own. And that's because nightmares are actually behaviors. They're things that the brain does. They're not just things that happen to us that fall into our lap.
Right.
They're things that the brain actually has to come up with. And
Oh,
so if you
yeah.
think about it like this, it's almost like driving a car down a country road and the road is kind of muddy. And every time you drive over the tracks that your tires have made before, the tracks get a little bit deeper. And the deeper that the tracks get, the harder it is to get out of those tracks. So if you frequently drive down the tracks of having nightmares, then your brain is learning to do that more and more easily. And it's harder and
Mm,
harder to redirect your brain to not do that. So
mhm,
then our brains end up doing that kind of over and over again because it's gotten in the habit of doing so.
mhm,
So getting out of that track means rehearsing alternatives to your nightmares. So especially if you have a recurring nightmare, you can note down what happens in this nightmare, write it down, be pretty detailed about it, and rehearse an alternate ending or an alternate anything else. You can choose any element of the nightmare that you don't like and be creative. Come up with a
wow.
new solution. Like give
Yeah.
yourself a magic wand in your dream that you can wave and everything else freezes and you can run away. Or you can draw a door in midair and go through it and you're gone. Or you can fly out of danger. Or whoever is chasing you or whoever is in the dream that you don't like, you can change that to a different person. So you can be creative because after all, this is your brain that's coming up with this stuff. It's your dream. You're the boss of this nightmare. So if you frequently rehearse this and really think about the new ending or the new element
Mm,
during the day when you're not sleeping, then your brain is
okay.
actually more likely to have this different dream, this more pleasant
Wow.
dream when you're sleeping. But if that doesn't work, you may need a little bit more support or help from a behavioral sleep medicine specialist, someone who can help you with things like frequent nightmares or insomnia.
Right. Wow, that's fascinating. I had never thought of that because a lot of times we think of our nightmares as us not being in control because we're not fully conscious. But if you can recall the nightmare and then work on that in the conscious state when you're awake, then that would make sense if you rehearse that enough times that when your body goes into that not so conscious state that you may rehearse that alternative ending instead. So that's powerful. That's
Yeah,
great.
it's really fascinating. And it's interesting because this approach, it sounds way too easy to be true, like way too good to be
Yeah.
true. And I would
Yeah.
never have believed that it would work if I hadn't seen it work really well.
Wow.
So it's
Wow, that's
really
amazing.
fascinating what the brain can do.
Yeah. Yeah. And so that being said, can you share some of your research collaboration findings on sleep and some of the ongoing studies that you have?
Sure, I would love to. So, my area of focus in sleep research is trying to improve sleep or looking at how sleep interacts with other medical or psychiatric illnesses. So, back in grad school, I looked at sleep in people with Parkinson's disease and looked at how sleep and circadian rhythms interacted with some of the other symptoms
Hmm.
Parkinson's disease, including cognitive impairment or mood impairment, and fatigue. And more recently, I've been working at Duke with some other researchers on some really cool studies, I think. One is looking at whether we can improve insomnia in people with insomnia and hypertension, and seeing if improving their sleep can also improve their hypertension and thereby decreasing their risk for cardiovascular disease later down the road.
Hmm.
And I really like this study because this really gets back to what I was saying earlier about raising the water for all boats, right? Like if only we
Right.
could improve sleep, maybe it could improve our cardiovascular functioning, and it could decrease our risk for heart disease. It could decrease our risk for stroke, decrease our risk for maybe some other areas of health like obesity or metabolic functioning. Now, we're not measuring all of those things in this one study, but I think this is
Hmm.
one important area to look at because so many people have heart disease in this country. And I think it's worthwhile looking at every modifiable behavior or modifiable risk factor to see
Hmm.
how we can bring those numbers down. And if we can get people to sleep better and have lower blood pressure, then
Hmm.
that could really do wonders for our overall health as a society. And we have a similar study going on, also looking at cardiovascular outcomes, but we're specifically looking at sleep in people with insomnia and post traumatic sleep disorder. So I mentioned earlier that people with PTSD tend to have more sleep problems, which I think is pretty intuitive. You can imagine that if someone has experienced psychological trauma, sleep would be affected. And we wanted to see if by improving their insomnia, even if we don't touch their PTSD at all directly and don't provide trauma focused therapy, if we just improve their sleep, can we improve their sleep, their trauma symptoms, and their cardiovascular health? So these are
Hmm.
two ongoing studies that we're doing at Duke, and I am about to work on some research, work on some papers looking at more trauma related sleep disorders to see how exactly trauma can affect sleep and if there's something really unique about that, or whether it's similar to insomnia or other sleep disorders.
Wow, that sounds fascinating. And thank you so much for sharing that with
Of
us.
course.
We know how important sleep can be for medical residents and many in the medical field, and yet this population tends to struggle with getting adequate sleep. Can you share research findings on sleep in this population with us?
Sure. Yeah. So this is a really good question because I think medical residents are dealing with kind of the opposite of insomnia, which is that they're not having trouble, or some of them are, but
Mm.
the biggest problem isn't that their own brains and bodies are keeping them from falling asleep or staying asleep. It's that they really don't get the opportunity to sleep as much as they want to and as much as they
Right,
should. So
right.
they're pulling all nighters because they're on call, or they're doing rotating shifts where they're sometimes on night shift, sometimes on day shift, and they're doing really long shifts. So they're ending up having not only their sleep disrupted, they're also getting their circadian rhythms disrupted. So remember earlier I said everything in the body and mind basically works better and runs better when all of the circadian rhythms in the body run in sync. Well, if you are doing rotating shifts and sometimes you sleep at night, sometimes you sleep during the day, sometimes you don't sleep for 24 hours, then that really throws off one of the biggest rhythms that your body and brain have. So
Mhm.
then your metabolism and your cognitive functioning and your hormone secretion, all of these rhythms start to not be in sync with your behaviors and your cognitive function. And that ends up being detrimental to all aspects of mental and physical health. And so that's really more detrimental for the medical residents themselves in the short and long run. But it's also unfortunately detrimental to the patients that they're working with. And this is by no means the fault of medical residents. I want to make really
Right,
clear that they
right.
do a really, really hard job and they are doing their best and they're extremely talented and smart people doing their best. And they're handicapped by the fact that they don't get to sleep the way their body really wants to sleep. So they
Mhm.
end up not being able to perform as well or to feel as well. They can't concentrate as well. They can't make game time decisions as quickly. They are not as quick to respond to crises, and they're less able to emotionally regulate. And all of these functions are extremely important in a doctor, because I can imagine that if a loved one of mine or myself were to need emergency surgery or something like that, I would really hope that someone who is well rested is working on us, because that person is able to make good decisions and be alert and not be falling asleep during procedures, not be having these little micro sleeps happen while they're awake. Because even as you're standing there awake, fighting really hard to stay awake, your brain will sometimes pop into a little bit of sleep. Or that local sleep I was mentioning earlier, the more sleep deprived you are, the more likely parts of your brain are to go into deep sleep-like states. And that is not really good if you're doing surgery on someone, for example.
Right. Wow, that's amazing. So my final question has to do with your podcast, which I absolutely love. You are the host of the award-winning podcast, The Savvy Psychologist. What made you want to start this podcast, and what kinds of topics do you address on the show?
Well, thank you so much, first of all, for your kind words. I'm so glad you like the podcast. It is a labor of love, and I always love it when people can benefit from it. And I actually did not start this podcast. My good friend and mentor and colleague, Ellen Hendrickson, she's an associate professor at Boston University, and she actually used to be my supervisor when I was getting training there. And she started The Savvy Psychologist about 6 years ago. And she did a fabulous job building it from the ground up. And this is a really good format, I think, and a really fabulous premise for the show that she built, which is this weekly quick and dirty tips podcast that is about a 12 to 15-minute show each week where we share psychological science. So we're very evidence-based. We always go to the research. And we also translate the science into tips that will benefit our person in their daily life. So not just, research shows that nightmares are more likely to happen if you drink alcohol late at night, but also, well, here's what you can do to get your sleep back on track and to prevent nightmares. So I really like it because it really gives me the chance as a psychologist to take the research that we do in the ivory tower and translate it into something useful, hopefully, for people, and maybe also just interesting or fun or entertaining. And I really like to disseminate psychological science and sleep knowledge. And this is a great way for us to do it.
Wow, I love that. Well, thank you so much for sharing all this amazing information with us. And thank you for being on our show.
You're so welcome. It was a pleasure to be with you. Thank you.
This episode has been brought to you by the NEI Prescribe app. The most powerful tool for your prescribing arsenal is here. Based on the best-selling prescriber's guide, NEI Prescribe app gives you access to full prescribing details, including expert tips and pearls, more than 140 psychiatric drugs, and with the unique filter feature, you can identify treatment concerns specific to each patient in order to generate a customized list of possible medications to review. With full prescribing details for more than 140 psychiatric drugs, the NEI Prescribe app could help you in your practice. Go to www.neiglobal.com.